Hello, everyone. Welcome back to Neurospicy Nursing. Today, we're going over pediatric respiratory conditions, and yeah, that's really all I have for you guys. So let's get on into it. Also, well, let me pause. If I sound a little bit congested, I'm sorry. Really bad allergies. I have a dog, and he likes to roll around in the grass and likes to sleep on my pillow. So just bear with me. All right. So thinking big picture. The core triad of the respiratory system is going to be oxygenation, ventilation, and perfusion. When things start to go wrong, like infection or if they have a hydration issue, we tend to think hydrate and get them to be comfortable. Um, but if really any three of these things drop off and then an infection is added on to it, kids tend to kind of drop out a little bit. So, the biggest thing to remember is that kids are not tiny adults. We like to think of them as tiny adults, but they really, really aren't. Um, Unfortunately, they're not small versions of you and I. We have different um structures because of we have developed more, right? Kids also have small spaces. Their structures are floppy because they haven't had time to develop. So it causes really, really fast obstructions. That goes with their oral cavities. Their tongues tend to be a little bit too big for their mouth. It's very small nostrils. If you've ever seen little kids get Lego pieces stuck in their noses, it's hilariously scary. Also, they have a floppy epiglottis. Again, it comes with that immature cartilage, and it tends to collapse, especially when it has been flexed. Their tonsils and adenoids tend to be really, really big until they hit about age 12. That's why the younger, the better for tonsil removal. And they tend to have a lot of soft tissue that just hasn't fully developed, so they tend to get a lot of edema. Just really, the airway itself is soft tissue, so it's just a place where edema can really thrive. So we have to make sure that we're paying attention, especially for edema. So the first thing that we're going to go over, and I just wanted to mention really quickly, things that are not included in this PowerPoint that are respiratory conditions slash infections. Croup, we're doing a deep dive into that one, as well as cystic fibrosis. There's a deep dive, five-slide fix for both of those. Okay, so viral infection patterns. Just what I want you guys to think of, okay? All of these are going to be prevented with hand hygiene. They have a lot of the same kind of symptoms-ish, right? Nasopharyngitis, obviously you're gonna have a runny nose. Tonsillitis, if it's viral, because there's viral and bacterial. Sore throat, you can also see a sore throat sometimes with nasopharyngitis. Bronchitis, they can have a wet cough. Sometimes it's dry. It normally starts dry and then becomes wet because of the phlegm and whatnot. And then RSV, it's it can be upper and lower airway. Um, and it's highly contagious. We have vaccines that can kind of help with it, and then I'm going to go over that a little bit later. I have a whole slide about the different types of vaccines. Um, but biggest thing about RSV, remember, it loves to live on surfaces. Okay, so we are making sure that we're cleaning them off of surfaces with those special purple wipes. Um, because it will stay there longer than that 12-hour shift. Okay, that 12-hour shift that feels like death. Well, RSV decides it's going to stay longer, so make sure you clean those surfaces. All right, bacterial infection patterns. So if it's a bacterial strep throat, abrupt pain, fever, difficulty swallowing, okay, very important. They cannot return to school, however, until they've been fever free for at least 24 hours. If it's tonsillitis, we're going to watch to make sure that they don't have an airway obstruction because the inflamed tonsils, that edema can cause that airway obstruction. If they have had a tonsillectomy, we're avoiding red foods. We, if we have to suction, we really don't want to, but if we have to, we're doing it carefully. and we're watching for bleeding. One thing with tonsillectomies is that if they start excessively swallowing, that is a sign of post-op bleeding. So watch out for excessive swallowing. You probably will see that on your test. For pertussis, they're going to be on antibiotics because it's bacterial, and it can last from 6 to 10 weeks. Okay. Biggest thing to remember about any of these conditions here, if they're drooling and they're agitated, we're going to be worried about their airway. They can't breathe. Okay, so ear infections can be caused by viral infections, okay, especially otitis media. They will have ear pain, fever. They can be pulling at their ear. They can have a bulging tympanic membrane that's super duper red. Remember, it's supposed to be kind of that silvery, clear color. You'll see amoxicillin if we're doing eardrops. Remember, if they are a kid, we're pulling it down and back. If it's a little bit older, up and back. So I think it's teenagers are kind of the cutoff for up and back. 12. I'll put it in the description if that's incorrect, but I think greater than 12 up and back, younger than 12 down and back, but look in the description just in case that's not correct. And then if they do end up with tubes, we're going to try our best to keep water out. So no swimming, no submerging, nothing like that. Keeping water out. And then again, eardrops. We already kind of went over it. Um, Also, there's something called bottle propping. I want you guys to remember, don't prop the bottle up into the ear. Like, don't directly stick it into the ear canal. Okay. That's not how we deliver eardrops. Sorry, eardrops. Okay. So, general nursing care. For really all of them, very, very similar nursing care. Humidified O2, right? So if we have any secretions, it's going to decrease the secretions because that humidification will help thin out those secretions. Suction if you need to suction, and then saline drops can also help with that very thick mucus. If they are very, very little, we're going to make sure that they're still being breastfed, still have formula. Obviously, when kids are sick, they lose their appetite. So if they're not doing breast milk, if they're not doing their formula feeds, we can introduce some Pedialyte if we really need to. And if they are older and have started to introduce solid foods, we're just going to keep them on like soft, bland foods. For comfort, we're going to do ibuprofen and Tylenol and a cold cloth for any fever. It's going to help bring that temperature down. We're really going to avoid over-the-counter cold medicine though. Not really helpful in any of these conditions. And then for parents, we're going to teach them monitor their temperature, no school unless their fever has broken for 24 hours. Make sure they stay hydrated. If it's a infant and they still have open fontanelles, any de decrease in that fontanelle, like if it's depressed, that's a sign of dehydration. Or like sunken eyes, that sort of thing. Signs of dehydration. So red flags. These red flags are all going to point to when we should start panicking, which would be if there's really any sign of deterioration. So tachypnea, nasal flaring, grunting, retractions. It doesn't matter if it's substernal or in the clavicular region. Clavicular? Like you guys know who that is? Clavicular, that guy who mogs. I don't know. But that clavicle region, if they have a fever of greater than 101, it really should be if it's greater than 104. I like to tell people 100.4, not 104, sorry, 100.4. But up to a fever of greater than 101. If they refuse to eat. Now, this one is key, okay? If they stop, like if your kid, like let's say they're really just a good eater, um if they all of a sudden decide that they don't want to eat, that's a red flag because if they stop eating, they're working too hard to breathe. So make sure that you guys remember that one. That's a really, really good one that you'll see on tests. All right, so Pretty standard prevention here. Cover your cough, clean the surfaces, hand hygiene, replace your toothbrush after the first 24 hours of antibiotics. A lot of people don't think about that one, but it carries bacteria, right? So just make sure that you change it out. Avoid smoke. That's on here because it's an irritant to the lungs, right? So if they're already sick, adding an irritant is just going to make it worse. For the ear infections, if we reduce pacifiers, upright feeds, and then breastfeeding is actually going to be a preventative method for otitis media. And then vaccines related. I want to go over this because it's important. You have all of the ages in which you can start getting the vaccine. So influenza is going to be 6 months annually. Annually is kind of a right? Because if it's within the season, you can get it. Hopefully that makes sense. So let's say they got the flu vaccine in, I don't know, February, and it's now October. Technically, it's a different flu season. They can get a new vaccine. Just keep that one in mind as well. Um, Nursivimab, that is for RSV. All infants are going to get that if they are less than 19 months. Pavlozumab, I can't say that, sorry, but these are for your high risk infants less than 29 weeks, so your premature babies, whatnot. This is also for RSV. PCV, DTaP, T Tdap, and then I put when you would get Tdap in pregnancy as well, because you might get asked that question. But make sure that you look at this. It goes over again all of the times in which you can start getting or the cycles for those vaccines. Okay, these are the resources, and that's all I have for you guys today. Look out for that croup and the what did I say the other one was croup and oh, cystic fibrosis lecture from me. All right, guys, thank you so much. Have a great day. Bye.